guys, welcome to the channel or welcome back to the channel. For anybody new here, my name's Justine and this is the Bee Bunch family, and we are a family channel that consists of family vlogging, advice on parenting, marriage, and infertility. So if you want to know our full story, there will be some videos linked below because I know there's some new subscribers that might want to catch up with our story. But today I'm going to be talking to you guys about a pregnancy symptom that kind of happened to me when I was pregnant with my daughter Anna, who's now a little bit over 1 year old. It's something that I'm still kind of dealing with, and I'll get into it. But it's something that's pretty common, and I feel like it's not talked about, so I'm going to make a video on it. And that is dental issues during pregnancy. So that's what I'm going to be talking about today. So if you're someone who's pregnant, watch this video because it's actually more common than you think. Or if you're pregnant and you're already dealing with it, I'm going to give you tips for how to manage it as well. So basically, I wanted to make this video because honestly, pregnancy related dental issues or pregnancy gingivitis, which is the diagnosis, is actually way more common than you think, but no one ever mentioned it. I had no idea about it when it happened to me, and I had no idea of the effects like long term or how it affected your pregnancy or what to do about it or how to manage it. I really didn't know that pregnancy affected your teeth and your gums at all. And like during my pregnancy when that happened, I learned more about it, and even now that like I'm catching up with my dental health because of it, I'm learning so much from my dentist and from my own research, and I wanted to share it because I actually, in research for this video, I looked up how common is pregnancy-related dental issues and pregnancy gingivitis. It said that 60% to 75% of women will get some form of pregnancy-related dental gingivitis in their pregnancy, and that was huge. I'm like, wow, that's a pretty big number. Like, it's not like 90%, but it's a pretty 60 to 75% to me is pretty substantial for something that we don't talk about and something that my care team did not educate me about. I had a midwife, I had the OBGYN, I went to all my appointments. No one ever talked to me about that, and I did tell them that my gums used to bleed more often, and they said, oh, that's normal during pregnancy, but they didn't really mention what it was or the effects. And I just think it deserves more to be talked about because I'm still kind of dealing with having to fix the damage from my teeth, and I also just didn't know about it, and it could be managed. It can't really be prevented, I don't think, but it can be managed. So let me take you back to the beginning when this started. So when I was pregnant with my daughter Anna, I got pregnant. I found out I was pregnant in August of 2021, and I gave birth March 28th, 2022. So that's the span of when I was pregnant. My daughter is now 15 months old. So during my second, I would say like the beginning to middle of my second trimester, I really started getting a lot of pain in my gums, bleeding when brushing my teeth, and just a lot of like discomfort in my gums, and it's kind of like swelling, redness, discomfort. And I actually, at first, I was so scared that something was actually going on with my teeth because I was already in my second trimester, and sometimes dentists don't want to do certain things for you. So I was like, oh my god, if I have like a cavity or a root canal or something that's substantial dental work, they might not want to do it, or how is that going to affect the baby? As a first time mom, I was like, how is that going to affect the baby? So but when I called my dentist and when I went to my dentist, it actually was pregnancy related gingivitis, pregnancy related dental inflammation, and really and truly there's nothing wrong with your teeth. There's no filling, there's no root canal that they can do. What he told me was that in some women, the pregnancy-related hormones that are increasing most of the time within the second trimester, but this can happen anytime during pregnancy, will cause your gums to just become inflamed, and that it would go away after the pregnancy, and there wasn't much you could do, but it will go away after the pregnancy. However, come see him after because it needs to be. Sometimes there's a little bit of damage, and it depends how bad it is. but come see him after. But he said like he couldn't really give me like the treatments that they give for regular gingivitis while pregnant because they use certain chemicals that they don't want to use on pregnant women. So he said it was just about managing it. He recommended that I start brushing my teeth more than twice a day, so like 3 times a day, and that I use a specific mouthwash, and he recommended that I just stay away from certain like acidity foods and just kind of take extra care of my general like oral health while pregnant, because it can attack it just attacks your gums. Like he said, the hormones attack your gums basically is what happens. And I was surprised because he told me that it was pretty common, and I had never heard of this. I never heard any of my friends or pregnant women in my family or anything like that talk about this. I've never heard a midwife or a OBGYN mention it. I never heard anything. So it kind of was like shocking that that was what was causing all my pain, because I would say it was pretty substantial pain or discomfort. So I did do that. I stepped up my oral health. I was on top of it. But honestly, like he said, the hormones are going to increase too. So it's kind of like a tug of war. And so I would still get the pain. I would still get the inflammation. The bleeding did slow down when I upped the oral health, but the pain and the swelling and the redness and the inflammation kind of went along with the hormones, to be honest. And then as I gave birth to my daughter, it did go back to normal. But now, fast forward, I went, postpartum, going back to the dentist now, because of the pregnancy-related gingivitis, I just had like weaker gums, and that led to a root canal that I just got done, and just like fixing up my teeth. Now, I'm gonna preface this by saying that I also was already doing some dental work before my pregnancy, and then the global pandemic hit and my dentist was closed for a while, and then slowly getting back. I was starting to fix things when things opened up again, and then I got pregnant and there were certain procedures that they didn't do. So that could also be why my pregnancy related gingivitis was worse than maybe some others. But like I said, I had never even heard that it could be a thing, so I just wanted to make this video to make people aware and kind of tell you what my research is. Now, I'm gonna say a disclaimer. I already put a disclaimer in the beginning of this video, so you can go read that. But the thing is, I'm gonna say a disclaimer again. I'm not a doctor, I'm not a medical professional, I'm not a dentist. This is just a video that I'm making to inform people of something that I feel isn't talked about and is pretty common. And this is just based on my own research, my own experience, and what my dentist or dental team has told me on how to prevent it in future pregnancies, how to manage it now, and what they told me when I was pregnant on how to manage it, and tips and tricks that people can try if they're pregnant and dealing with any type of dental discomfort, gums, and anything like that. But if you are pregnant or trying to get pregnant and you're dealing with any type of discomfort in your mouth, swelling, bleeding, all of that, call your dentist, go see your dentist, and make sure that there's nothing else going on, like an infection or something that needs emergency treatment, because sometimes they don't really want to do dental work while you're pregnant. But if something's an emergency, it's best that it be taken care of, because it can affect your baby. But if it's not an emergency, they pretty much won't touch you after your second trimester. So that wasn't, my pregnancy related gingivitis wasn't considered an emergency. It was something that he says just happens to some pregnant women. So it was just step up your oral health and come see me when you are past 6 weeks postpartum, was basically the recommendation. So I did do that. I used the mouthwash. I started brushing 3 times a day. I did step it up. Like I said, it did help, but again, your hormones are still going up and down during pregnancy, and so the hormones are what causes it, and so there was really no getting rid of it. It was just managing it. And then, like I said, when I gave birth, after 6 weeks postpartum, I did make the dental appointment, and now it's just like catching myself up. So recently I had to have a root canal with a specialist, because it was a root canal in a molar, and he actually, when he did x-rays, he actually told me that he saw a little bit of the damage from pregnancy, and that could have contributed to the gingivitis or the swelling in the gums as well, which he told me it was more like calcium. What he saw in my teeth, what he saw in my x-rays was calcium deficiency, and he said that that was caused by pregnancy. And he actually told me that, I asked him like how could that be prevented, and he told me to, like, if I ever get pregnant again, you should be taking a extra calcium supplement. And I told him, I was like, well, I was really diligent about my prenatal vitamins, and he told me most prenatal vitamins don't actually have either enough calcium for a pregnant woman or calcium at all, and that calcium is super important for a pregnant woman. So in order to protect your teeth and your bones during pregnancy, you should actually be taking a pregnancy supplement on top of your prenatals that you're already taking. And he told me he has personal experience with that too, as well as just being a dentist and seeing women all the time with this, because he told me that his wife suffered from the same thing and that she took a supplement and that it did help and things like that, and he's seen other women in his practice with the same thing. So he told me to start taking a calcium supplement to kind of revert the damage, and also like to take it for the next 3 months to kind of revert the damage, but also that if I ever get pregnant in the future, to make sure that on top of my prenatals, I'm taking an extra calcium supplements as well. And that's something that I didn't know. I didn't realize that most prenatal vitamins either don't have enough calcium or don't have calcium. That was surprising to me, since calcium is so important for pregnancy. So it was really weird. I don't have my prenatal vitamins anymore. I finished them, and I didn't buy more because I'm no longer pregnant. But so I didn't get to check my specific ones, but either way, he said it can't harm you because it's so important in pregnancy. Just take a little bit extra, and that was his recommendation to me. Like I said, I'm not a doctor. So I was doing, I am doing that now just to revert the damage, and I will do that if I get pregnant in the future. So that was my experience, and I just wanted to share it. And I really was shocked that this was something so common. 60 to 75% of women struggle with this and have damage from their teeth with pregnancy. And I was so shocked that this was something that was so common and no one spoke about. So I thought I'd make this video. I said, like, the second part of this video, I'm going to tell you how you can manage this if you are either trying to get pregnant, because honestly, oral care does affect that. Trying to get pregnant, already pregnant, or if you're somebody who already gave birth and you're struggling with this too. These are some things. So I would say that from my research and even from what the dentist has told me, most women will struggle with this in your second trimester. But I would say what my advice would be, from the day you find out you're pregnant, or even if you're trying to get pregnant, up your oral hygiene, just because. Even if you have really good oral hygiene, because the hormones that kind of attack your teeth no matter what, just up your oral hygiene. So brush your teeth, obviously in the morning, obviously before bed. And what I do is I throw in after lunch. So now I brush my teeth after lunch, and if I do feel like I get something stuck in my teeth or anything, I'll give it a quick extra brush even. Also use so what they told me to do and what's been helping me is what I would tell anybody to start doing if they're trying to get, like, instead of waiting until the damage like I did because I didn't know, do this when you're trying to get pregnant and then when you do get pregnant, which is using a mouthwash that is not just for teeth and enamel but also has gum protection as well. So there's a few out there, just most of them have it now. People are starting to get on the train that your gums are, the foundation. But, some of them are more like, oh, tartar and build up. Like, make sure that the mouthwash you're using also supports your gums. The other thing is, I hate flossing, like manual flossing. So instead, you can buy a water pick. So if you like to floss or if you don't mind it, for me, like, my teeth are really close together, and then because I had the bleeding and because I was pregnant and I did have the pregnancy gingivitis, sometimes it was so sore, you guys, that I could not even try to floss. So it was that part I couldn't. And the bleeding was a lot when you would floss or anything like that. So I couldn't, but I did find that if flossing is too hard for you because of that situation, you can get like a water pick and just do that once a day. But please, please, please make sure you keep your water picks super, super clean and sterile, because you don't want any bacteria getting in there, because you don't want any bacteria getting into your teeth, your throat, or anywhere near there. So always, always, always clean it before and after and sterilize it and all that stuff. Follow the instructions and make sure you're using very clean water. But as long as you're doing those things, water picks are super good. And the other thing is trying to avoid too much acidity and things like that. And if you are drinking something with acidity or with sweetness, using a straw so that it's lessened on the gums and the teeth. The other thing, and this was something that I heard from my dentist recently, which I asked him, like, how can I get rid of any excess, like excess inflammation that is still lingering, or like or if I get pregnant again, like, what is something natural? Is there something natural that I can take or do? And he said that you could do cucumber water. He said that cucumber water actually strengthens your gum line. So that's something natural that you can incorporate into your diet. That's pretty easy to incorporate into your diet. Not only is it easy to incorporate into your diet, but it's good for you, not just in the gums, but it's good for maintaining weight. It's good for hydration. It's good for, like, there's a lot of benefits to infused water, especially with like cucumbers and stuff like that. I usually used to do a cucumber and lemon, but I stay away from the lemon now because I'm doing it for the gums as well, so I don't want the acidity. So I just do straight cucumber, and I don't add any fruit or anything because that's sugar, that's bad for you. So, but just the cucumber, he said, actually strengthens your gums. So incorporating those things, instead of waiting, I would just incorporate those when you're trying to get pregnant, when you are pregnant and postpartum, and then afterwards I would just incorporate whatever I needed to as well, to just up my oral health as a woman, because we're always going through hormonal changes. And as I learned from this experience, and as we learn, hormones do affect your gums apparently. So yeah, guys, that's my experience with it. That's the advice I was given, and those are my tips and tricks for managing it. If you're someone who's trying to get pregnant, like I said, if you're already pregnant and dealing with it, if you're trying to avoid it and you're pregnant, and definitely postpartum, guys, because postpartum, your hormones are fluctuating even more. And so even if you didn't deal with it during pregnancy, it can also happen during postpartum. So I would definitely up my oral care and use those tips and tricks, and even talk to my own dentist if I was somebody who just gave birth. I'll talk to my own dentist, get their advice as well, and just stay really diligent on making sure that your gums don't suffer too much when you get pregnant and welcome your precious baby into the world. So that's my video for today. I just wanted to give some advice on that. Hope you guys enjoyed. If you have any questions, leave them in the comments below, and let me know what other pregnancy related or parent related topics you want us to take on. If not, I'll see you guys next week.